Hello, I am Dr. Rajasekhar Mysore from Chirag Global Hospitals at BTM second stage, Bangalore. What is stool DNA test? Nowadays, this is a fashion. People are asking for a stool DNA test and all. I'll explain. Most of you may be knowing about DNA. DNA is deoxyribonucleic acid, which is present in every cell. Every living cell will have DNA except a few viruses. So this DNA is the basis for all our functions. So a functioning of a cell. So if there are changes in the DNA, in some of the cases, it can produce cancers. When cells in the large intestine, if they are becoming cancerous, so first thing happens, what changes happen in the DNA. So if there are some diseases like polyps or mild cancerous, this one just beginning of the cancerous thing, we may not be able to do. For everybody, you can't go on doing colonoscopy. So the high risk groups, especially in the Western countries, colon cancer is one of the very leading causes of death. So they do regularly colonoscopy and other tests. So in that stool DNA test, because it's a simple stool test, in that they will see the cells which are shed from the intestinal lining membrane, and in that they will try to detect the DNA, because it is easy to detect DNA rather than the cells. So it is a very highly sophisticated test there, and once it is changed in the DNA, when they notice that these people are having cancer, are likely to develop cancer, they will be able to make out. So this is the significance of stool DNA test. Can it replace colonoscopy? No. Colonoscopy is where we go into the large intestine with small camera and check everything, take photographs, if required we take a biopsy. So stool DNA test is more or less a screening test. Colonoscopy can also be used for screening, and for confirmation again colonoscopy will be required. Even some procedures, some polyps are there, you can remove using colonoscopy. Whereas this is a test that it can be used as even an interventional procedure also. So both have got their own roles. That will be decided by the concerned doctor, medical or surgical gastroenterologist.